Hello, everyone. This is Professor Widener. Welcome to the Clinical Orientation for Nursing 612A, the Advanced Practice Nursing Clinical Synthesis. You will see my notes on the right-hand side, and that's mainly because I didn't want to forget anything, and you have access to those on the PowerPoint as well. But I want to say how excited we are that you are here in your last clinical semester, and you as a group are especially important to me because we started in our first semester together in 2019. So it's very exciting to see you all, how far you've come. And please know that I'm so proud of all of you. Please take a minute to go through this, listen to the PowerPoint, and then you need to take the quiz. Remember, you need to get a 90 or greater on the quiz to start clinical, but you can take it as many times as you need to. I suspect that most of this information will not be new to you, though, and you will do just fine. The clinical faculty, again, for section 1 and the lead faculty for section 2 is myself. And for section 2 is Amanda Crambo. Both of us have our information on the course homepage. If you are in section 1, please know that I will be the one that is completing your site visits, grading your assignments, and making sure you have your midterm and final grades. If you have Amanda for section 2, she will be in charge of getting your site visits, grading your assignments, and doing your evaluations. And she should always be the first person that you contact. I will be available as a resource to her and as a resource to you if there's something that you need help working out. Please remember as well, as I said in the syllabus syllabus video, please remember too that the office hours on Tuesdays on the even weeks, they are listed on the course homepage, and they are for both section 1 and section 2. These are the course objectives that are here for you to review. They are also on your syllabus. The methods of evaluation are similar to what your other clinical courses have been. 75% is your clinical experience, and the other 25% is made up of discussion boards and journals. Remember that they all must be completed, including your HESI test and your clinical logs to pass the course. There are no new textbooks required, and you will get the multimedia packages from Barclay and Associates. And again, I can't say this enough. If you need help with them, let me know. And if you have not received an email from Barclay at this time, please also let us know so we can get you access to them this week. These will be how you start to get prepped for your national certification exam. These multimedia packages are basically like a review course, all bundled up for you. So this is a good way to start practicing. Please review the course policies as listed here when you get a minute. And I'm sorry, I see a typo here. It will be, obviously we're not using Typhon anymore, and we're using Project Concert. We're going to go over some things now specific to clinical and Project Concert. Remember, your clinical clearances must be up to date before you are allowed to go back to clinical. You must also complete this clinical orientation module and the quiz. Once you have received an email from your clinical faculty, you will be able to get up and running with clinical. Please know that one orientation site visit can be made prior to the start of clinicals. The purposes of this is to kind of get your login information, figure out how the office works, what the policies and procedures are for your clinical. You should set that up with the manager, but please know that that does not count towards your clinical hours. For this course, it is 3 credits and 135 clinical hours, 121 preceptor hours, and 14 post-conference hours. The breakdown for the post-conference hours are 1 hour for the clinical orientation, 5 hours for the discussion board, 7 hours for the Barclay. So there's 7 journals total. So you get 1 hour for each journal and 1 hour for the HESI journal. Remember, please, 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 when you're documenting your post-conference hours, that you document them appropriately. What you did and who was your instructor. For your preceptor hours, it will be whatever preceptor you were with that day. For your post-conference hours, they will be marked under whatever course faculty you have. And we'll talk about that a little bit more. Your midterm evaluations are required to be completed by midterm around the 6th to 7th week. Your preceptors will get them via Project Concert. Please, in your first week or two of clinical, make sure that we have the best email information for your preceptor. You can send that to me or Professor Cranbrough, and we will make sure that it gets to Melissa Markham, so your preceptor can complete the Project Concert evaluations. That is how they will also get their clinical certificates. So it is of benefit to use them as well. This semester, you will also get reminders when your clinical evaluations have not been completed. It is your responsibility to make sure that they are completed. If you need our help, we will certainly help you with that. If there are any issues with Project Concert or your preceptor is having any trouble with that, you can please send an email to Melissa Markham. She is able to help with any Project Concert issues. Once your evaluations are completed, whether it be the midterm or the final evaluation, you are able to complete those. I'm sorry, you are able to see them as well. Again, any problems, please let us know. We do have 1 or 2 preceptors that decide that they do want to complete paper evaluations. We do allow this in rare instances. So please, if you're having any problems with midterm evaluations, obtaining them, final evaluations, whatever it might be, again, communication, just let your faculty know. Should there be anything that is unsatisfactory at midterm, a site visit will be made specifically for that reason, and the student will receive a learning contract pointing out all the elements that need to be resolved or improved upon prior to completion of the semester. So there's plenty of time to make any remedies that need to be made. As far as your final evaluation, your preceptor will do a final evaluation, and your course faculty will also do a clinical evaluation. Both of these can be reviewed by the student. Remember, that is the faculty member's final summative evaluation. That is the primary consideration when doing your final grade and doing your final evaluation. Remember, your clinical course grade is based on the clinical site visit, the completion of documentation, required paperwork, assignments, professional behaviors, and participation in post-conference activities. Students are required to provide their clinical faculty with a tentative clinical schedule for the semester. It may only be that you know your schedule for a month, and that's okay. But I need you to either let myself or Professor Cranbrough know when you will be at clinical. It is very important that we know when you're at clinical, so that if any issues arise, we know where you are and how to help you. Any changes in your schedule should be brought to the clinical faculty so that they can be updated on your clinical schedules. This includes any changes that might come about because of COVID. At least one site visit will be made by the faculty during the course of the semester. Students and the faculty will facilitate coordination of those visits. We typically do them after midterm. If for some reason you are moving through your hours more quickly than you thought, please make sure you let your faculty member know. In light of COVID, there are some clinics that are not allowing additional people at the site. In that instance, we will make either a phone call or a Zoom visit, but ultimately we would like to come do a site visit if we are allowed. But again, we will work out in light of the COVID restrictions, whatever we need to do. Please remember that faculty have the right to make an unannounced clinical site visit if it's deemed necessary based on performance or any other issues that might arise. As far as your clinical hours tracking, because you are in your second and third year of clinical rotations, you are expected to log a minimum of 10 to 15 patient encounters and a minimum of 5 SOAP notes per clinical week. Please remember that this is all part of your grade, and completing these SOAP notes and figuring out how to do that will be useful for you when you go to apply for a future job. Your clinical tracking logs are legal records, because when I fill out your forms to send to the state that say you have completed our program and all the required hours, I need the evidence to show them that you have completed all those hours, should indeed they ask for it. Remember, when entering your clinical case logs, I know this is a reminder for most of you, but remember, all information must be handled specifically based on the HIPAA laws. You should never use identifying information in the case log or any other clinical documents, assignments, or remove anything from the clinical site per the recommendation. Sometimes you'll be able to, after your patient, at the end of your day, you will be able to have time to do them as soon as you get home. Sometimes you will have time between patients to do them. Please do them as soon as possible, because that is how you're going to get the most useful experience out of all your clinical experiences. Writing those SOAP notes, getting those thoughts in about what you thought about during your day. So please do them as soon as possible. I know that it is easy to get behind, but please try very hard not to do that. The other thing that is super important, I want to go back one page. I think I moved it without. We have set up a system now that we've been using for 2 semesters where the preceptors are automatically given a preceptor recognition with the hours that they precepted you, because they often need it for their recertification on their licenses. And again, remember, it's also a legal record. So we know where you've been, the kind of patients you've seen. So if an accreditor or the state ever asked for that information, we would have it. So please, please, please remember, when you are entering your data into Project Concert, please select the right site. So for example, there might be 20 Geisinger sites. Make sure you pick the right Geisinger site that is there for you. If you do not see the site in there, please contact your course faculty or Melissa Markham. The right preceptor means that post-conference and simulation hours go under your course faculty, and precepted hours go under your preceptor for that day. If you have 2 preceptors, make sure you pick whatever preceptor you're with, again, that day. Now, if you spend a few hours with someone, like with an interesting case, you certainly don't have to put them in for, an hour or 2. You can put under your primary preceptor, but just remember to put in the correct preceptor. The other issue is you want to put in the right program. So your program is either adult gero primary care or a family nurse practitioner. You want to pick one of those 2 choices. You do not want to pick the BSN to DMP options, because again, we need to know that you completed those clinical hours for the type of nurse practitioner program that you're in. If anybody has any questions about that, please just ask, but that is super important. Again, your Project Concert case logs, again, this should just be a review. They need to be done within 7 days, and there will be 0 tolerance for falsification of any clinical records. Should there be falsification of any clinical records, this will result in immediate dismissal with no option for readmission. As far as your assignments, this just talks a little bit about late assignments. These are the Barclay journals. This is self-paced. Again, I recommend creating a map And there is an example in module 1 of a map that you can make that kind of gives a suggestion, but it does allow for some flexibility based on individual needs as well. And we've really found that that works a lot better for students. The discussion board is in the second semester, the second module, and that's going to talk about, you're going to review the AANP certification, and you're going to answer some questions about that. As with the other clinical courses, you will take a final HESI exam and journal. Remember, this is taken during week 13 or 14. And again, we'll provide you with more information about that. As a final reminder, you may not start clinical any sooner than the first day of clinical. You must have an email from the faculty stating that all clinical clearances are met, and you must have completed this clinical orientation. Be sure to review all these and the important syllabus and course dates. And I am just going to switch slides for a moment, and I'm going to bring up our COVID policy for this spring. So I wish we didn't have to keep talking about COVID, but unfortunately we do. So I just want to review with you a couple things for the spring of 2022. Number one, we have purchased KN95s for all of our students, and they will be coming to you in the mail this coming week. We ask that you please follow the guidance of whatever clinical facility you're in, but because of the increased transmission of Omicron, and it's obviously much more transmissible than the other variants that have been out there, we did feel we wanted to provide all of our students with a box of KN95s. So that will be coming to you this week. But again, please follow your clinical policy and do whatever you're comfortable with. But as the graduate faculty, we did think that that was important for you. So please remember, any student, regardless of their vaccination status, should monitor themselves for symptoms daily of COVID-19 and be aware of any possible exposures. We're not, again, going to ask you to specifically document that you're monitoring yourself daily, but please be in mind of the symptoms. With Omicron, there are many more respiratory symptoms, sore throat, and there are also gastrointestinal symptoms such as diarrhea. Any student who has symptoms should remain home from clinical that day, and please follow the current CDC guidelines and contact your primary care provider. Should you have a COVID exposure, regardless of vaccination status, please again refer to the current CDC guidelines, and there is a link to them right there. If you stay home because of an exposure, symptoms, or a positive test result, please make sure the first person you alert is your preceptor that you will not be there that day. Then you also need to let your clinical faculty and Professor Banker know about your absence. At that time, you will be guided with when and how you can return to clinical. If you are positive for COVID-19, Professor Banker will coordinate your return to clinical with you and will provide you with a return to clinical form that must be signed by a provider prior to returning. Misericordia has some guidelines that can be found at misericordia.edu/coronavirus. Most of their guidelines fall under on-campus students, but if you have any questions about the university's response, you can find it there. Should you have any questions or concerns about this, please feel free to contact me. Again, we will work with all of you and support you through this semester, but we did think it was important to have a specific policy. Most of you are working on the front lines, and we're so thankful that you're there supporting our patients. We know it's been a long 2 years, and we're so proud of you for getting this far in your nurse practitioner program in light of all the obstacles and different situations we've all faced. So please, if you have any questions about this, just let me know. This ends the clinical orientation, and we're so excited for you. And if you have any questions, please reach out to myself or Ms. Crambo.